All right, so this will be our first video where we get to address the concept of upper limb fractures. And this is all around um, us trying to give an introduction and talk about different parts of the upper limb that are easily fractured. So, what we got is this. So, say upper limb fractures is just any fracture in the hand, okay, the forearm, the arm that makes it upper limb. So it just refers to break in the bones of either the shoulder, you could have the forearm, you can have the wrist or hand. Okay. So what are the parts of these places that easily get fractured? We have the clavicle is the first. Clavicle is the most common and usually occurs mid shaft. Okay, midway. Then we have the proximal humerus fracture. So after the clavicle, you have the humerus bone. Okay, the human body is like this from the shoulder region down. You have the elbow is go down like this. So that's what you got there. So clavicle there. You can also have the proximal humerus fractures. They are often seen in older adults with osteoporosis. That means what? The person have weak bones already. So they can involve one or multiple parts of the humeral head or neck. Okay. They will have the humeral shaft fractures. They are transverse, they are oblique. A key complication is, when they see fracture there, the radial nerve could actually get injured. Then we have the distal humerus fractures, which is common in children, especially the extension type injuries. Then we have the forearm fractures. Okay, this one you're coming down to the level of the radius and the ulna. So you can have the Colles fracture, which is fracture in the radius, but which is towards the wrist. Okay, you can have the Monteja fracture, which is what the ulna, and the radial head. You can have the Galeazzi fracture, which is what the distal radius. Okay, then we have wrist fractures, which is the scaphoid is the most commonly fractured carpal bone there. You have a lot of pain in the anatomical snub box. Okay, and it's actually a hallmark sign and also poor blood perfusion. Okay, so the blood supply there will be reduced so much. They will have fractures that could occur around the hand and the finger. So fractures around the metacarpals, the phalanges, and they mostly affect the function of your hand, your ability to grab things like you used to grab before. Okay. So key points to remember here is children often sustain supracondylar fractures. While for adults, you mostly have, all those clavicular fractures and distal radius fractures. Then anytime there's a fracture, always try to assess if there's an injury to what the nerve supply or there's an injury to the blood supply, you know. So stable fractures may be treated conservatively with cast of splints, and rehabilitation is always very essential, you know, to restore mobility. When the person is fractured, they can now use splints, cast to keep the person hand in one place. So as the person is healing up, you always what make sure that the person is back to exercising that part of the body, so that at least their motion is kind of like back and restored.